Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, we are going to continue with our Healthy Living Tuesday theme right here on Extra. Now, once again, please join me in welcoming our good friend, Dr. Jitka Lom from Express Care. She once again graces us with her presence to answer your questions regarding heavy breathing and asthma. Now, doctor, welcome back.
Thank you so much.
Okay, asthma is something that certainly is no laughing matter. You know, for those of us who know people that are asthmatic and everything like that, it can be very, very painful. It can come on very acutely, and people certainly, I mean, it's not a pleasurable experience and everything.
No, it isn't. It makes people feel as though they're going to die. Losing their breath is a very frightening experience.
Now, what exactly causes asthma, and is it more environmental, or is it something that you inherit from other people, or is it something you can catch?
Well, those are great questions. Asthma is a disease of the small airways of the lung. If you begin with your breathing tube here, your trachea, it divides into your two bronchi, the big tubes, and then into smaller and smaller and smaller tubes till you get down to your lung, which looks like a sponge. So asthma is a disease of the very smallest little airways. It's amazing that all of these airways are not just pipes and tubes. They're actually surrounded by smooth muscle, tiny, tiny little muscles that can be twitchy. And so things in the environment can trigger. For example, cigarette smoke, pollution, dander from pets, other smoke in the air, even just the air temperature changing, being cold, can cause these airways to trigger. They'll twitch, they'll shrink down, and so it'll be like the person's trying to suddenly breathe through a very small tube. And so when you're breathing through a small tube, you may hear a whistling sound, and that's when we hear the wheezing and the chest tightness that they experience.
Okay, now you, of course, and the very fine work that you and your colleagues do for Express Care, you're a family practitioner.
Yes.
And you're trained in that field. And of course, when you're examining young children and everything, you always look for symptoms and, what do their parents have, and, is that possibly transferred down? If parents have asthma, how likely is that they will pass that on to their children?
If both parents have asthma, then it's about 6 times as likely that their child will have asthma as if compared with a child that has parents with no asthma. If only one parent has asthma, then it's still a little bit more likely. So yes, it does run through the generations.
Now, I unfortunately had bronchitis once, and I got that as a result of a bad flu, and like other people have also shared, they've gotten that. How does bronchitis play, and can it develop into a more, hopefully not permanent form of asthma, or will it be a recurring thing?
Right. So that's an excellent question. What's the difference really between asthma and bronchitis?
Yeah.
Bronchitis is a disease of the larger airways, higher up the breathing tree. Asthma is a disease of the smaller airways. You can have both coexisting. People with a tendency towards asthma may develop bronchitis also, and vice versa at times. But the treatment can be a bit different because the larger airways don't respond quite as well to the breathing treatments that we would give people with asthma.
Now, here on Guam, and given our heat and our humidity, are asthma sufferers more likely to have outbreaks and and bouts with asthma, or are they less likely and everything? And like compare, we were talking before, and you said probably the best place to live if you are asthmatic is Arizona.
Yes,
okay.
A cool, dry climate is best for people. Here on Guam, when the humidity is very high, asthma sufferers may have more trouble when the pollen counts are high, and also when we have volcanic explosions nearby, or other dust clouds coming through, we may have more trouble.
Oh, okay. And then probably the other question is, how does stress trigger asthma, if at all?
It does. Stress affects asthma in that our airways may become twitchier, our resistance is lower, and even just emotional upset can trigger an asthma attack. Okay,
so asthma is, going back to what we talked about in the beginning, it can be behavioral, it can be perhaps hereditary, and it can be brought on by things.
By environment, exactly.
Oh, okay, and then real quickly before we go to our first commercial break, because we do have the viewer questions and that we got from Facebook, how can people combat asthma? Or, if they felt like, like sometimes I get shortness of breath, they're maybe not sure what type of lifestyle can they adopt?
Well, I think keeping their overall breathing hygiene very good is important. So they would want to stay away from people who smoke, stay away from fires and other environmental pollutants. They'd want to keep themselves in good health and wash their hands so that they don't pick up other, colds and viruses that may trigger their asthma.
Okay.
And they shouldn't have pets that would trigger it either, especially cat hair seems to be a problem.
All right, that's a good tip. Both my parents are actually allergic to cats. All right, very well. So you ready to get to the viewer questions?
Yes.
Okay, so am I. Well, stay tuned, my friends, because when we come back, the good doctor will answer your questions that we gathered from Facebook. Stay tuned. We'll talk more about asthma when Extra continues.